I'm Dr. Anita. I'm a consultant gynecologist and fertility specialist at Miracle Reproductive Center in Kilpauk, Chennai, Tamil Nadu, India.
I'm Dr. Gechama, gynecologist and fertility specialist at Miracle Advanced Fertility Center, Kilpauk, Chennai, Tamil Nadu, India. During this discussion, we would like to create a certain level of awareness about a very common condition which our women face, and it is called as fibroid uterus, which may be present in almost 30% of our women, but most of the time it goes unnoticed. But sometimes it can become really a difficult situation. It all depends on what kind of a clinical presentation of this condition. It depends on the size of the fibroid, the location of the fibroid. Sometimes a very big fibroid is almost 10 centimeters may go totally unnoticed, but in a very tiny fibroid may actually hamper your life. It may affect your regular activities, it may cause severe pain, heavy bleeding, and it may also affect your fertility to some extent.
So fibroids as such, the word is not a reason to panic among childless couples. One thing is like we have to take out the myth that fibroid is not a cancerous condition. It is a very benign tumor, and as my colleague was mentioning, it all depends on the location and size. There are different kinds of fibroids according to the medical term. One variety can be present inside the cavity of the uterus where the child exactly grows. The other variety can be present on the uterine musculature of the uterus, and the third variety is present outside. So the third variety, like what I was mentioning, doesn't cause any issues at all in conceiving, and even in the later stages also. Only accidentally when you do a scan you might find it out. And the second variety, which is present within the uterine musculature also, around 30 or 40% only might cause some symptoms. That is, during menstruation you can have heavy bleeding or pain, or when you come for a treatment of fertility, then it might be noticed. Again, when it is only interfering with the inside lining of the uterus, the cavity, then we need to think about any surgery options. And the first variety that I was mentioning, which is within the cavity, might cause problems in conceiving. But then there are a lot of treatment options available. We can look at it, find out the size, and based on that we can offer treatment options for childless women, and you need not worry about it at all.
Most common of the times you present to your doctor only because you have severe pain during your periods, or you have severe heavy bleeding during your periods. This is a most common presentation of fibroids. But sometimes incidentally you happen to find a small fibroid inside the cavity of the uterus, which may be leading for infertility issues in you. And diagnosing the fibroids, the most common modality is by ultrasound. Any number of fibroids, any size of the fibroid, wherever it is located, everything can be diagnosed by doing a simple ultrasound. And if you have to think of surgical options, laparoscopically, we can remove any number of fibroids or whatever size of the fibroid it is. Earlier, it was not possible to have, to remove all this kind of fibroids by doing a laparoscopy. But of late, with the advancement of the techniques, we can even remove a 10 centimeter fibroid with a small 1 to 2 mm or 2 centimeter port by using a morcellator. It means you are removing the fibroid and then you actually grind it and remove it using a morcellator, so that you don't have to open up, make a wide incision in your abdomen. Or sometimes even if it is inside the uterine cavity, it can easily be removed by doing a hysteroscopic procedure. Hysteroscopy and laparoscopy are the most advanced techniques available for fibroid removal, where the procedure will not take much time, as well as your hospital stay, blood loss, the morbidity, mortality, everything is being reduced by doing these procedures. So all of you can opt for these procedures when it has been diagnosed. But that doesn't mean that if there is a small 3 centimeter fibroid or 4 centimeter fibroid, or if you see a fibroid, doesn't mean you should remove it. It only depends whether you need to analyze, the doctor has to analyze and find out whether it's really necessary for you to remove that fibroid, whether it is interfering in your lifestyle or in your fertility issues. That is what is more important. And after surgery, we have to take a break of at least 3 to 4 months. we need to give some time for that, for the uterus to heal, involute and come back to its normal size, and then we can plan for pregnancy as such.